A maxillectomy is one of the most functionally impactful surgeries in the head and neck cancer population. And the 3 to 6 month window following radiotherapy is critical for our patients. I'm Lauren Meffin, speech-language pathologist, certified lymphedema therapist, and a therapist who specializes in head and neck cancer rehabilitation. Today, I want to walk you through what clinicians should be monitoring and treating at 3 to 6 months after a maxillectomy, particularly following radiation. This phase is a critical point in your patient's rehabilitation. In the 3 to 6 month mark, many patients are no longer in the acute phases of their recovery, but they're not stable yet. This is often when swelling will fluctuate, jaw tightness is progressing, dry mouth and taste changes become impactful on our patient's nutrition, swallowing fatigue becomes more apparent, and with a structured plan, these issues can be improved, but without one, they can compound. One of the most important things to monitor after a maxillectomy is lymphedema. Clinicians should be watching for puffiness in our patient's face, neck or submental swelling, tissue that feels firm or does not soften over time, and management will often include therapist-guided lymphatic drainage pathways, prescribed compression garments, daily monitoring for changes, targeted exercise to support our patient's lymphatic flow, and exercise tracking. Consistency here is what matters in our patients. Xerostomia is another word for dry mouth. Dysgeusia means taste changes. Dry mouth and taste changes are common during this phase. For xerostomia, strategies may include frequent sips of water, sugar-free gum or lozenges, saliva substitutes, sometimes sprays will help, and avoidance of caffeine and alcohol will be recommended by your medical team. And for taste changes with dysgeusia, experiment with different food temperatures. Add herbs or mild spices to your food. Retry the flavors monthly because your taste will continue to change. Keep things simple. We encourage a log and a journal. Taste recovery is variable. Patience, unfortunately, is part of the plan. Now let's talk about trismus, jaw mobility, or any stiffness. Jaw tightness or trismus is another major concern following a maxillectomy. The muscles have been surgically altered in our patient's treatment plan to eliminate their cancer. During this phase, patients are taught a structured jaw rehabilitation program such as the ARKJ Wedge and stretching device. They are taught to perform jaw stretches daily, track their progress, complete this weekly, not sporadically. All small losses and jaw openings now can become major functional barriers later. We encourage massage and manual therapy as an additional support in your trismus rehabilitation. Let's talk about dysphagia, swallowing difficulty after a maxillectomy. This is highly individualized. Maxillectomies in the 3 to 6 month range following radiotherapy include principles where we monitor our patient's ability to take in liquid, advance their textures from the liquids to the solids, monitor our patient's fatigue with chewing, with moving things around in their tongue and lips. The goal is not only fatigue monitoring, but also safety. We want functional, sustainable swallowing, not just getting by with our feeding tube. Recovery after a maxillectomy looks different for every patient, but consistency with exercises, tongue trainers, ARKJ wedges, compression garments, and a home routine for your manual lymphatic approaches are all part of our guide for a larger survivorship framework that I use in our head and neck cancer rehabilitation. You can find the full resources linked below with additional clinical tools for your daily rehabilitation.